Hi everybody, and this is the first of 3 postnatal rehab and recovery sessions that I'm going to be posting over the next few weeks. So this is session 1. I'd like everybody to start here. So regardless of when you had your baby or how you had your baby, I would like you to start with this session. It might feel like some of the things are quite basic, but it's really important to get this information in and get the fundamentals right before you move on to more advanced forms of exercise. Particularly if you're aiming to get back to impact exercise such as running or some particular sports, it's really important that you take things in a very progressive and gradual way to get to that ultimate goal. So it's really important that you take those appropriate steps to get there, starting with what we're going to be going through today. So it's a level 1 session. I would suggest that you wait until you're 6 weeks postnatal before you start doing this session. And the reason for that is just to make sure that everything is healing up properly. You've got adequate tissue healing, scar tissue healing, before you start to load the tissues too soon. There are some schools of thought that say that if you've had a relatively straightforward delivery, and you feel okay, you could probably start exercising before you get to that 6-week mark. But saying that, even with straightforward, uneventful vaginal births, we know that it still takes at least 8 weeks for that inflammation and tissue healing to really start coming in. So ideally it's good if you've had your 6-week check just to get that ticked off, but obviously at the moment we know that things are services are quite limited, so chances are you haven't had an opportunity to have that. But still, I would wait until that 6-week cut-off point, and if you still feel that you're not quite ready, if you've still got pain, or if you've still got discomfort, or if you're just not happy, then just wait until you're a little bit further along down the line. We know that it takes sort of 6 to 8 weeks for your uterus to settle down. It can take 6 weeks for the bleeding to stop. So just be kind to yourself and just make sure that you feel ready before you undertake this class. What I would also say is that if you've had an episiotomy, or if you've had a perineal tear, so a grade 3 or a grade 4 perineal tear, you might find that you want to wait a little bit longer than the 6-week mark, just to enable everything to feel like it's sort of settled down and healed up okay before you start. If you've had an OASI, so an Obstetric Anal Sphincter Injury, hopefully you're under a physiotherapist anyway, having some input through a health professional. But if you are having ongoing symptoms like fecal incontinence, for example, I would suggest that you wait that little bit longer before you start doing this session. So the aims of this session are really to go through some of the changes that occur during pregnancy, common symptoms that you might be experiencing, and of course we're going to start with some exercise just to start building you back up again from the inside out. We're also going to talk a little bit about diastasis and how you can check for that, which is essentially separation of the abdominal muscles at the midline. Lots of people are aware of diastasis. Some women are a little bit concerned about their tummy in the postnatal period. Again, you just need to be a little bit kind to yourself, or very kind to yourself, particularly at the 6-week mark. It's very early days still, and there's, things can still improve and change. And sometimes things just need a little bit of time just to settle back down again, and just, you just need to take things gradually in terms of, in terms of what's actually going on in there and with your tummy muscles. So we'll talk a bit about diastasis as well, and then obviously we'll do a class, a very low level beginners postnatal class, just to start getting things firing off. So common symptoms in the postnatal period that we do need to be aware of. We've talked a little bit about fecal incontinence. So sometimes if you have a significant perineal tear, or particularly if it's affected your anal sphincter, you can have symptoms of fecal incontinence in the postnatal period. So this is something that really does need to be managed by a physiotherapist, a women's health physiotherapist. So if you are having any symptoms of that, then, and it hasn't been addressed or nobody's aware of it, then I would definitely recommend you either contacting myself or contacting your GP, perhaps having a telephone consultation. Make sure that people are aware of those symptoms, because it's important that you are referred. Obviously, again, we don't really know what the situation is in terms of what is actually going on, what services are available at the moment, but it's important that you do get some advice about it. The other thing to mention is urinary incontinence. So urinary incontinence in the postnatal period is very, very common. If you've had it during pregnancy, you're more likely to have it in the postnatal period as well. But it's not a normal symptom to have. So although it's very common, it's not normal. So even if you're leaking just a little bit here and there, on coughing or sneezing, or, moving a little bit too quickly or bending over, it's not a normal problem to be having. So don't think that, I've had a baby, I'm leaking a little bit, it's to be expected. It's not really something that you should be experiencing. It might be that things are weak. So obviously, if you've had a vaginal birth, it significantly stretches the pelvic floor, which can cause weakness of the tissue. You can have some nervy problems going on down below, again, because everything gets overstretched. So things just might not be working as well as they were down below. And that can obviously cause some leakage. So you might find that when you start to exercise and just build up a little bit of strength, things do start to improve. However, it's really important that if you are having those symptoms, that you refrain from doing any impact exercise, so running, jumping, anything that involves both feet being away from the ground at the same time. And the reason for that is that it puts a lot more strain through the area, so it puts a lot of more impact through the pelvic floor, so everything has to work even harder to support things. So it's possible that you could make your symptoms worse if you go back to doing impact exercise too soon in the postnatal period, particularly if you're having those symptoms. The other thing to say is that although Pilates can be really useful for managing or trying to get on top of urinary incontinence, it's not the first line of treatment that is recommended. The first line of treatment is actually doing some pelvic floor strengthening, but that needs to be specific to you as an individual, and it needs to be a prescribed exercise program. So again, ideally through a women's health physiotherapist. So yes, Pilates is very useful, but you need to be making sure that you're working your pelvic floor in isolation as well. So again, speaking to a women's health physio is really important if you've got symptoms of urinary incontinence, and if you've got any problems with regard to that, I am available, so feel free to contact me, or as mentioned, maybe contact your GP surgery and see what is available at the moment, and if you could be referred to somebody if it's an ongoing thing. Other things to try and sort of think about are whether you actually have pain down below. So a lot of women, obviously, after having a vaginal delivery, get, if you've had a tear or an episiotomy, you get scar tissue formation. And what can sometimes happen is that the pelvic floor muscles, instead of being weak or kind of low tone, they can actually go into a bit of high tone. So they can actually get a bit tight and short, and that can actually be a problem in its own right as well. You can still have symptoms of urinary incontinence. You might have other symptoms like, could be a huge array of symptoms such as bladder frequency and urgency, so going to the toilet more often or feeling like you need to go to the toilet more often. You might have constipation, you might have pain during sex, you might just have general pelvic pain in that region. So there's lots of symptoms that can be associated with that. But it's important to know that if you do have hypertonic muscles, so muscles that are a little bit on the overactive side, actually starting exercising and strengthening and doing more kind of contraction might actually make those symptoms worse. So again, it's really important just to monitor that, and if you feel like things could be on the overactive side, again, it's important to get some advice about it, because you might find that the more exercise you do, potentially it could make your symptoms worse. So again, just really listen to your body, and don't stop straight away if you're not happy, or if there's anything that you feel doesn't feel quite normal or quite right. The other thing to say is that sometimes women do get prolapses after they've had a vaginal birth. Now, again, these are really, really common problems. Again, it's normally linked to the fact that things have weakened. So the muscles stretch, the fascia, so the connective tissue within the pelvis, which help to support your pelvic organs, so your bladder, your bowel, your uterus, also are overstretched and they're weak. Now, if they become overstretched and weak and the nerves aren't also doing their jobs properly to help innervate the muscles and keep them active, it means that sometimes the pelvic organs aren't being supported quite as well, and you can get this relative downward movement of those organs. So when that happens, you can have lots of symptoms. Again, you might be leaking urine, you might have urgency and frequency from your bladder, you might have discomfort, you might have aching, pressure, dragging, heaviness in that region. You might actually physically feel a bulge inside your vagina. A lot of women get very upset and anxious when they have symptoms of prolapse, which is completely understandable. However, these are symptoms that can and do improve. Again, pelvic floor muscle training is the first line of treatment for low-grade prolapses. So again, it's something that needs to be tailored and individualised to you. I am going to be posting some separate videos on my main page about prolapse and pelvic floor and how you can activate it and how you should be activating it to suit you. So please keep checking back and having a look at those. But if you're not happy, if you're concerned, if you feel like any of the exercises that we do bring on those symptoms, make them worse, stop straight away, contact me. And if you've got any concerns, again, reach out to a women's health physiotherapist, I would say, as a first port of call. But again, maybe contact through your GP surgery as well and just see, what's available at the moment in terms of getting help for that. So those are the main symptoms that we need to be aware of in the postnatal period. If there's anything else, so if there are any sort of pre-existing underlying medical conditions that you have, then again, feel free to contact me just to make sure that you're safe and clear to exercise before you start this session. But it's going to be a very low level, very gentle session. The aims of this session are to educate you a little bit about posture to start with, and breathing, and how that's really important for getting your core functioning normally again in the postnatal phase. The other thing we're going to do is we're going to connect with your pelvic floor, and we're going to start thinking about connecting into your core generally. And then obviously we're going to do an exercise session to build on that and gradually sort of progress through. Now, in terms of time scales, obviously a lot of the time scales are thrown out there. So for example, the 6-week check. A lot of people think once they get to that 6-week mark, that's it. They're fine, they're okay to do whatever they want to do, they can go back to running, they can do X, Y, and Z. It's not always that clear cut. So we have to remember that every woman is different, everybody's body is different. Different people heal at different rates. And obviously just taking into account your medical history, so in terms of your obstetric history, so how many babies have you had in the past? Have you had a cesarean? Have you had a vaginal birth? Have you had a couple of each over the years? So that is all going to sort of be relevant for how you are now and sort of what sort of timescales we're sort of aiming for in terms of getting you back to where you need to be. We know that your uterus takes up to 6 to 8 weeks to come back down to its normal size. Obviously, it takes a while for bleeding to settle. And sort of by 8 weeks after a normal vaginal birth, you've still got some healing and inflammation still in there that's still settling down. But that's not the same for everybody. Some people will improve sooner, some people will improve, will keep improving after that time scale. So it really depends on the individual. I would always say that you need to be really waiting until the 12-week mark before you start thinking about returning to impact exercise. So really it's just to make sure that you've got some adequate strength of the pelvic floor coming through, as long as you've been doing your exercises and built it up enough. And again, just to make sure that things have knitted back together a little bit more before you start loading things too much. So just to talk about posture then. So when you are pregnant, your posture changes significantly, and that has to happen. It's a very normal thing that happens during pregnancy to allow for your baby to grow and obviously for you to give birth. So this is my pelvis. So this is me just standing facing you in front. Now, when you're pregnant, what tends to happen is that as the baby grows, you develop the bump in front, which then makes you sort of come into an anterior pelvic tilt. So the pelvis sort of generally tilts forwards. Now what that does is it throws you into this position, okay? So you generally get a bit more of an increased lumbar lordosis or curve in the small of your back. Your pelvis tilts forwards, which actually has an effect of lengthening your pelvic floor muscles underneath. So it actually puts them into a lengthened position, which is a very inefficient position for the muscles to actually contract properly. So that has an effect on weakening into the pelvic floor. Now, when you've had your baby, your brain doesn't suddenly say, okay, I've had my baby now, let's suddenly just snap you back to where you were. Because you have to remember that you've been in that place, so you've been in this position now for probably the best part of, 5-6 months? So when your bump gets big enough to start to bring you into that position. So you've had a long period of time where your nerve pathways and your brain has actually started to recognise that posture as being normal. So once you've had a baby, you don't suddenly spring back to where you were. Your pelvis doesn't suddenly think, okay, let's go back to where we were now. So a lot of women tend to stay in that pregnancy position, okay? But we know that if your pelvis is either tilted too forwards or indeed back the opposite way, so if you're actually tucked under too much, which can also sometimes happen, not so much in postnatal women, but it can happen. We know that your pelvic floor muscles and your core muscles don't work quite as well. So when we're trying to re-educate those muscles, we want to try and make sure that we're thinking about your posture and trying to get you into a nice neutral position through the pelvis, because that's where we get optimal contraction of the pelvic floor and of the core itself. So thinking about your tummy, mainly, but tummy, back, diaphragm as well. So the other thing to say is that when we're trying to re-educate your core, we're not just thinking about your tummy, we're thinking about the core as a whole system. So we have your pelvic floor muscles underneath. So as you can see, this isn't the best model of a pelvis, by the way. I can't actually take the uterus out. If I could, it would make life better. But you can see underneath that the red here so this is the muscle. So you can see that the muscle attaches to the coccyx, so your tailbone at the back. It comes all the way forwards and attaches to your pubic bone at the front, but then it also comes out to the side, so it attaches to your two sitting bones as well. So it forms a big muscular sling underneath at the bottom of the pelvis. So it's a really important muscle, does loads of really good stuff, but it has a big role in actually providing stability to the pelvis underneath. It supports the pelvic organs, but it also works with your core muscles as a quite an important contributor to the whole core system. So we have the pelvic floor underneath. Then we have your deep tummy muscles. So when we're thinking about tummy muscles in respect to postnatal health, initially we're trying to work the deepest layer. So you have lots of different layers of tummy muscle. The deepest layer that we're mostly concerned with is called your transversus abdominis. Now this is like a big corset muscle. So it attaches down to the front of the pelvis. It has fascial connections into pelvic floor as well. It wraps around, so it comes all the way around your torso, and it feeds into the soft tissues at the back. And it's a really important muscle. It's a postural muscle, but it's a stability muscle as well. And it's that one that we want to try and build up before we start thinking about working those superficial six-pack muscles, obliques, rectus abdominis. So we want to really be working from the inside and then coming out. We'll talk a little bit about diastasis in a minute, because again, it's all very relevant and it all kind of sort of fits in with that as well. The other thing to say is that your diaphragm is important for core health as well. So it works as part of the system. So when you breathe in, what happens is that your rib cage needs to be able to expand out, and enable for that to happen. To enable that to happen, your diaphragm has to move down a little bit, and the rib cage can then expand out. When you breathe out, your diaphragm contracts, it lifts up, and that helps to expel the air out. Now, as your diaphragm moves, your pelvic floor and your deep tummy muscles that we mentioned before also are also very active. So when you breathe in, your diaphragm moves down, your pelvic floor also moves down, and it has to relax a little bit to enable to do that, and your tummy muscles have to relax to enable that to happen as well. When you breathe out, the opposite happens. So your pelvic floor contracts and lifts, your tummy contracts, and the diaphragm contracts and lifts up as well. So again, it all works as part of a system. So we need to be considering all aspects of that system when we're trying to re-educate your core in the postnatal period. Just thinking about posture again. So if your posture isn't optimal, so again, if you're still in pregnancy posture, so if your pelvis is thrown forward and your back is overarched, your rib cage tends to be tilted up a little bit. So again, if your rib cage isn't in quite the right position, your diaphragm isn't going to be able to move quite as well, and again, that's going to be disruptive to the whole mechanism of how your core is working. So it's really important to make sure that you're aware of good posture before we go on any further. So what I want you to do is just bring your feet underneath your hips and just come up nice and tall. And then just make sure that your weight is even through the feet. So to enable you to sort of really recognise that, I just want you to imagine you've got a marble on the bottom of your foot, or on both sides. And we're just going to roll the marble forward onto the front of the foot, so onto the balls of the feet, and then just roll back onto the heels. And we're just going to keep going. So we're going to roll forward, and then we're going to roll back. So it's just a really small movement. I just want you to keep going, just really thinking about keeping your balance. Now, if we rest in the middle now, so come back down, and I want you to think about your big toe, your little toe, and your heel. And I just want you to think about making sure that those 3 points are just planted down into the mat evenly in terms of weight distribution. So we're not pressing back too much onto your heels. Your toes aren't lifting away from the floor. It's just a nice, relaxed, even pressure through those 3 points. Knees should be very slightly bent. Now we're going to come up to the pelvis. Just place your hands onto the brim of your pelvis, and I just want you to tuck your tailbone underneath. So if you imagine your pelvis is a bowl of water or a bucket of water, we're going to start with the water sort of level, and then I just want you to tilt the pelvis. So we're just almost imagining that you're sloshing the water back in the bucket, and then we're going to tilt forward so the water's going to come forward in the bucket. I'm just going to keep going. So tailbone under, and then reverse back off. And then I just want you to rest in the middle. So if you think about keeping that water level in your bucket nice and level, your pelvis shouldn't be overarched. It shouldn't be too flat. So we don't want this, and we don't want this either. So we don't want the tailbone to be really tucked under as much as possible, because that actually shortens the pelvic floor. We just want to be in the middle. So nice even weight through the feet. If you lengthen up nice and tall, so if you think about drawing your crown of your head up towards the ceiling, and your pelvis is just in a nice neutral position through here. Okay, so that's the first thing I just want you to practice, just making sure that you're aware of how you stand, where your pelvis is, and just seeing if you can get yourself into a nice neutral position into the pelvis. Okay, so It's something to try and do as often as you can throughout the day, particularly when you're standing. Because like I said, at the moment your brain probably isn't recognising that this is a normal position for you to be in. So the more you do it, the more automatic it's going to become, and that you're going to start actually, getting out of that pregnancy position. So now you're in neutral. Your rib cage should just be nicely stacked over your pelvis. Okay, so we don't want the ribs to be flaring up towards the ceiling, and we also don't want them to be dropping down towards the floor. Okay, so we just want to be stacked over pelvis, up tall, shoulders are down, and then just think about lengthening the crown of the head up towards the ceiling. So that is the first exercise I just want you to practice, so just getting into a nice neutral posture. Now we're going to finish with some work in standing at the very end of this session, but it's quite nice just to go through this as a starting point. So we're going to take it down onto the floor now. Now in terms of equipment here, obviously I have a mat. If you haven't got a mat, don't worry too much. Just use a towel or a rug, comfy rug, anything that you've got at home that's just quite comfortable to lie on. Obviously a mat is ideal, but if you haven't, don't worry too much. I wouldn't do this on your bed though, so just make sure that you've got a hard surface that you're doing it on. The other thing is I have a couple of head blocks. Now again, if you don't have these, don't worry too much, just use pillows, so just one flat pillow should be fine, rolled up towels, folded up towels, whatever you have at home is fine. So what we're going to do to start with is we're going to come down onto the floor. Now it's really important to mention diastasis. So a lot of women are worried about their tummies postnatally and are concerned that they have abdominal separation. Again, without having a proper check, it's difficult to know whether that is the case or not. A lot of people think they have diastasis, but they actually haven't. You also have to remember that it does take quite some time for your tummy to normalise again after you've had a baby. So like I mentioned before, it takes 6 to 8 weeks for your uterus to come back down to its normal size. So you may well have that kind of poochy appearance of the tummy for some time anyway after you've had your baby. So it's really important that you're kind to yourself in this time. It's not going to happen overnight. If you start doing, particularly if you've had a cesarean as well, so that's another thing to mention, you have to be careful in terms of rehabbing your tummy after a cesarean because of obvious reasons. You've got lots of tissue that's healing up, lots of scar tissue. So it's really important, regardless of how you've had your baby, that you don't start doing too sort of loading abdominal exercises before you're ready. So by that I mean planks, sit-ups, crunches, leg raises, anything that's sort of really going to cause a lot of strain to the tummy muscles, but also that's going to cause a lot of pressure within the tummy. So every time you do an abdominal exercise, you're generating pressure within your abdomen. Now that pressure has to go somewhere. It will always follow the path of least resistance, which is often the midline, which we'll talk about in a minute, but it will often push outwards into the tummy and you'll get this poppy up effect, either down below, sort of below the tummy button, or potentially actually centrally through the midline. But it could also go down into your pelvic floor. So if you're not managing pressure very well during those high level abdominal exercises, it can actually be quite detrimental. So again, it's really important that we start building your tummy up from the inside, get that nice fascial integrity and strength coming through before you start loading those superficial tummy muscles too quickly. So just to mention, so diastasis, so what is it? So diastasis is where you have your all of your tummy muscles connect into the midline. Okay, so you have lots of layers of tummy muscle. Down the centre, so coming all the way from the tip of the breastbone here, all the way down to the pelvis, you have a band of connective tissue called the linea alba. Now this isn't actually a muscle, it's more of a stretchy band which the muscle's attached to. It's really important for providing support to the abdominal wall. But during pregnancy, what happens, and it's a very, very normal thing that happens, is that everything has to stretch to enable your baby to grow. Now, the band down the middle has to stretch as well. And we know that by the end of pregnancy, so some studies have shown that 100% of women, by the end of their pregnancy, will have some degree of abdominal separation. So it's basically where everything stretches and you just get a bit of separation through the midline of your abdominal muscles. Now in most women, once you've had a baby, by sort of 6 to 8 weeks, that will start to come back together again. But in some women it doesn't always come back together, and they need a little bit of help to help to rehab the muscle in a very, very specific, gradual way to help with that connection and to get that separation to come back. Now obviously there are differing degrees and severities of diastasis. There are lots of factors which can or which are thought to contribute to the more severe types of diastasis, including genetics and soft tissue integrity generally, so people who are very hypermobile. Sometimes people think that if you've had a few babies very close together, that could also make things more likely, because the tissue hasn't had enough time to heal and come back together before it's then stretched again. So there are different severities. Now we'll go through a diastasis check. So you can have a little feel on yourself and just see if that is something that might be happening. But it is quite hard to feel on yourself if you don't really know what you're feeling for. So again, if you're not happy, if you feel like you need a bit of help with it, then contact me, or like we've talked about, maybe see if you can get a referral to Women's Health Physio through your GP surgery somehow. But it's really important that this is rehabbed in a very specific way, and that you don't load your tummy too much, because potentially you will make it worse, okay, if you do the wrong types of tummy exercises. So what we're going to do is we're going to lie down on your back. I just want you to make sure that you've got a support underneath your head. So we're just going to use a big block underneath your head. Now, it's quite nice just to lie with your knees bent up, so your feet, knees and hips are parallel. And before you start, just make sure that your spine is in a nice neutral position. So like we were doing in standing, I just want you to flatten into the small of your back first, roll back off, and then we're just going to rest in the middle, okay? So we're not overarched, we're not flat, we're just in the middle, okay? Now from here, what we're going to do is we're just going to have a little feel through your tummy, okay? So we're going to start in the centre, and I want you to feel your breastbone, and then just move down a little bit until you get to a little pointy bony bit. We're going to start here, so we're right in the middle. And what I want you to do, we're not going to do anything more than just this to start with. So I just want you to feel down the centre of your tummy. Now obviously, if you're 6 weeks postnatal, you might still have a bit of a pregnancy tummy anyway. So things might just feel a little bit soft generally, but hopefully if you work all the way down to your pubic bone, you could still feel like there's a little bit of tension through that midline. Don't worry if you can't feel that, okay? But what we're really trying to feel at the moment is, how does it generally feel? Does it feel like there's a bit of tension there? Can you feel like there's a bit of muscle activation, or does it just feel really soft and jelly-like? Okay. Now, if you can, we're going to start from the top again. We're just going to move down a little bit. I just want you to see if you can, again, start from the middle and just work out a little bit. And we're just going to feel what the muscles are feeling like more towards the outsides of the tummy. So you're starting in the middle. I'll just show you in this position. You're starting in the middle and then you're just moving your fingers out to the sides on both sides. So again, how does it feel? Does it just feel really, really soft? Can you feel the two halves of your abdominal wall as they sort of come together? Can you feel the edges of the two sort of halves of the muscles? Or again, does it just feel really just soft and jelly-like? So you're just feeling to start with. So the next thing we're going to do is I just want you to move your fingers down just so that they're resting a couple of inches. So if you just use two fingers, so your second and third finger, and then just rest them just slightly above your tummy button. Okay. So from here, what we're going to do is you're going to keep your fingers here. I just want you to, first of all, just recognise how the tissue feels under your fingers. So again, is there tension, or do the fingers just sink down and down and down and down and down? Does it just feel really soft? So we're going to hold that there. Then what I want you to do is we're going to keep the fingers on, and I just want you to lift your head away from your block or your pillow. And just notice if anything changes underneath your fingers. Okay, so what should hopefully happen is as you lift your head, you should feel the two halves of your tummy. So we're feeling your rectus abdominis or your six-pack muscles, and you should hopefully feel them drawing towards one another. And you should hopefully feel the two halves, so the two sides of those muscles come as they come together. Okay, now if you can hold it, then do. If not, just bring your head down for a moment, because sometimes it is a bit of a strain to do this in the postnatal period anyway. Have a little rest and then just come up again. And then just see if you can gauge what the distance is roughly between those two halves. So first of all, just recognise, is there a gap? And there probably will be, because most often is a gap there anyway. But roughly, how big is it? So how many fingers can you get in between those two halves of the tummy? And then what I want you to do, again, if you need to bring your head down, fine, and then come back up. If you start just above the tummy button, but then just see if you can move up a little bit. So just see if you can come 4 centimetres above the tummy button, still just feeling down the middle. And then come 4 centimetres below the tummy button and see how it feels down there as well. So we're just moving 4 centimetres above the tummy button, 4 centimetres below, and just getting a bit of an idea as to whether there is a gap there or not. So again, it can be quite difficult to feel this. If you've still got a bit of a pregnancy tummy, obviously if things are just generally really soft, and if you really can't feel anything, then don't worry too much about it, because this is only going to be a very basic session anyway. But if you can get a bit of an idea, it can be quite useful. What we normally say, what the research says, is if you've got a gap of about 2.5 centimetres, then that is considered a diastasis. So that is a separation of the two halves of your abdominal wall. So if you can get a couple of fingers plus in between the two halves of your tummy without any problems, then it's possible that you might have a diastasis there. The other thing that we need to be thinking about is it's not all about the gap. So people get so fixated on the fact that there is a gap in the tummy. But what does that actually mean? A lot of people have diastasis, they don't have any problems whatsoever. Other people have really terrible diastasis, so you're talking sort of 5-6 centimetres plus of a gap or separation. And it's those women that are more concerning, obviously. But it's also about what's actually happening within the gap that's really important to be aware of as well. So some people have very good fascial integrity. So what that means is that the connections of the soft tissues within the gap are sound and viable, and it's something that we can improve on and work with. Other people have gaps where the fascial integrity is not very good at all, and when you feel down into the gap, there's no tension there. Okay, so if you think about your gap, so if you have another lie down on your back, if you lift your head, so if you get your fingers just a couple of centimetres above the tummy button, if you lift your head, if you feel the gap there, but then just see if you can actually get your fingers down into it. So if you move your finger down, you might just want to use one finger, move your finger down into the gap towards the floor and just notice how that feels. So does it stop? Does it feel like it gets to a point where it won't go any further? Does it feel like a trampoline? So can you get your finger down to a point where it just feels quite tight, quite firm, quite bouncy? That is the fascia within the gap. So it gives you an indication as to what is actually happening within that gap. If your fingers just keep going down and down and down and down and down and down and down, so you can almost touch the floor, then that's a sign that the fascial integrity within the gap needs work and needs to be rehabbed, probably more so. So again, it's not all about the distance, it's about what's actually happening within the gap itself. The final thing to go through is, can you generate tension within that gap? So, and I am going to try and post a separate video just about diastasis, because as it's sort of eaten into quite a lot this session as it is already. But it's quite useful to know if you can actually generate tension into your gap. And if you can generate tension, then that's a really good sign, because it means that you can work with that and you can build on it and you can rehab and get your tummy back to where it needs to be. So what we're going to do now is we're going to go through how to activate your pelvic floor and your deep core. We want to try and be thinking about activating those muscles in association with your breathing, because like we mentioned before, everything works as a system, and we need everything to be working together properly. So we're going to think about your pelvic floor first. So as I showed you on my model here, your pelvic floor connects from your tailbone all the way forward and up to the front, to your pubic bone at the front, okay? So when we think about contraction, what we want is we want to try and get a full contraction of the pelvic floor rather than it just being in one place. Now there's been some research done recently that has shown that the best cue to engage your pelvic floor is to squeeze around your back passage. Okay, so if you imagine that you're in a queue, you need to hold wind suddenly, so suddenly you get this feeling you need to hold wind, you've got to hold it. You're going to try and squeeze the muscles around your back passage to try and stop you from passing wind, okay? So that will recruit into your pelvic floor. Now, if you can try and bring in the whole pelvic floor, we normally think about, rather than just focusing on one bit, we'd want to try and get the whole of the pelvic floor working. And in order to do that, we want to try and get a squeeze, but we also want to try and get a lift effect, okay? So what I want you to imagine is, I want you to imagine that you have a zip going from your coccyx, so your tailbone at the back, and it's travelling forward and up to your pubic bone, which is the bony point at the front of your pelvis. Now I want you to imagine that you're going to draw up into that imaginary zip. So we're going to squeeze first. So imagine that you're just clicking the zip in first. That's the initial squeeze around your back passage. And then I want you to imagine that you're lifting or drawing up through your zip all the way up to your pubic bone at the front. Now when you do that, I don't want any movement to occur around your pelvis. So I don't want you to flatten, I don't want you to arch. I just want you to stay in that nice neutral position. You shouldn't feel like your glutes are overactivating, so you shouldn't feel like you're squeezing into your glutes or into your inner thighs. Your shoulders should stay nice and relaxed. So we want to try and really isolate it to those internal muscles. Now, When you do that, so when you think about that zip going from coccyx up to pubic bone at the front, you should probably, or hopefully, you should feel some connection coming through into your lower tummy as well. So if you place your hands on the lower tummy, so below your tummy button. Okay, now we're going to breathe in to start. So just take a nice big deep breath in. As you exhale, we're going to think about engaging around the back passage. Draw up through your imaginary zip and just notice if you can feel any tensioning into your lower tummy. You may or may not. And then let it go. Now sometimes when you let go, you can feel some letting go occurring in your lower tummy, which means that you were generating some tension there. Okay, so we want everything to be working as a system. So we're going to breathe in, so that's obviously the action of the diaphragm. Breathe out, think about connecting coccyx to pubic bone, imagining that you're drawing up into that imaginary zip, and we're going to try and hold it. Okay, now I want you to hold it, but I want you to keep breathing as you hold it, and we're just going to count to 5. Okay, so breathe in and breathe out. Keep holding and breathe in and breathe out. One more breath in and out. And then let it go. Okay, so what we're doing there is we're connecting with your pelvic floor, but we're connecting with it as part of your core system. So with your breath, and particularly with your exhale, because we know when you exhale, you naturally engage into your pelvic floor, like we were talking about earlier, but also into your deep core. Now, with that in mind, what we can now do is go back to your diastasis test. So if you felt that you had a bit of a gap there, if you felt like your fingers were going down quite far, if you go back to getting your 2 fingers, place them just slightly above your tummy button, come into neutral again. Now we're going to take a breath in. We're going to go back to your head lift like we did before. So first of all, just lift the head without engaging. Go back to that feeling. Pop your finger down, see how far down it goes. Does it feel like there's tension there? Come back down. Now this time we're going to take a breath in. As you exhale, we're going to draw in through your imaginary zip. So we're going to connect coccyx to pubic bone, engaging your pelvic floor. Feel that tensioning coming through into your lower tummy. Now I want you to hold it. Take another breath in. This time we're going to keep that connection. As you exhale, we're going to lift the head. Hold it. Now feel and see if that tension has changed within your gap. Okay? If you can generate fascial integrity by connecting with your pelvic floor and your lower tummy, you will feel like your fingers don't go down quite so far within your diastasis or your gap. Okay? If you can feel like you've got some tensioning there, that's a really, really good sign, and that's something that you're going to be able to work with well. If you can't feel anything, please don't worry too much about it, because it might be that as time goes on and your body continues to change, and obviously as you start to connect and generate tension, generally with exercise, that starts to improve anyway. But it's something that's useful to go back to and keep sort of checking every now and again, just to see if you can feel any changes going on. But any concerns whatsoever, feel free to email me about that, okay? So now we know how to connect with your pelvic floor. So we think about that imaginary zip, pubic bone to coccyx. If you struggle to connect with your muscles, rather than trying to do a sort of a firm, strong contraction, what you can do is aim to just try and go to about 10 or 20% of what the maximal contraction would be. So we're just trying to get some activation of those muscles. Don't worry if you can't hold it for 5 seconds. If you can, great. If you can hold it for longer, brilliant. But at the moment, we're just trying to connect. We're just trying to get those nerve connections, those nerve pathways coming through to the muscle. Just trying to fire it off and switch it on, okay? What you can do, if you've got a rolled up towel or a cushion or one of these little soft balls, which some of you may or may not have, you can pop it in between your knees. So that just helps to activate into your inner thigh muscles, and it might help just to connect with your pelvic floor and your core just that little bit more. So we're going to just apply a little squeeze to the ball, same as before, so we're in neutral, hands on lower tummy, and we're going to go back to that activation. So take a breath in. As you breathe out, we're going to connect. So think about your zip, coccyx to pubic bone, hold it. As you connect, little squeeze against the ball with your knees, hold it, we're going to keep breathing. Keep holding. And let it go. And again, we're going to do another 2 of these. So breath in. And again, breathe out, coccyx to pubic bone. Hold it, breathe. So really important that you maintain the breath. Good, and relax, one last one. Just make sure that the whole body is nice and relaxed, so the shoulders don't hunch, your glutes stay nice and relaxed. So again, breath in, exhale, coccyx to pubic bone, little squeeze against the ball, not too hard, hold it, breathe. Last one. And let it go. Okay, well done. So hopefully now you've got a little bit more connection into your pelvic floor, and we're going to start moving things on a little bit now. So we're going to start adding in some other movements with it. Now the aim with sort of any sort of Pilates sort of workout is that before you do the exercise, you're pre-activating into your core before you move. So when we're going to move the upper or lower body, which we're going to do in a minute, before you move, I want you to think about that connection. So coccyx to pubic bone, feel the tension coming through into your tummy, and we're going to keep that tension on as you're doing the exercise, whatever it may be. When you finish the exercise, we allow things to let go. Okay? So the first exercise we're going to do is you're going to place your hands onto the front of the pelvis. So feel the 2 bony points on the front of the pelvis there. And we're going to do some hip opening. So the first thing we're going to do is connect coccyx to pubic bone. Feel the tension coming through into your lower tummy. We're going to breathe in to prepare. As you exhale, we're going to open one knee out to the side. Now, as you open the knee out, I want you to keep those 2 bony points on the front of the pelvis nice and level and straight. We're going to hold it for a breath in when you get to the end. Breathe out. Bring the leg back up to where you started. Okay, so breath in. We're connecting coccyx to pubic bone. Breathe out. Move the other leg out, keeping that connection on. Breath in, hold. Keep the pelvis nice and level. Breathe out. Bring that leg back up. Now we're just going to keep going for a few more each side. Make sure that you're only moving the leg you're moving, so the other leg stays nice and still. So breath in. Connect coccyx, pubic bone. Exhale. Move the leg to the side. Take a breath in at the end. Keep the connection on. Breathe out. Bring it back up. Breath in. Breathe out. Other side. Breathe in, hold. Breathe out. Bring it back up. We're going to do one more each leg. Breath in, keep the connection. Breathe out, move. Breath in, hold. Breathe out, back. Last one. and come back and let go. So hopefully you could feel some tensioning coming through into your tummy, but obviously into pelvic floor as well. So we're thinking about pelvic floor and tummy, not just tummy on its own, because that can often generate pressure that can then push down if you're just bracing into your tummy. So make sure it's both areas that we're thinking about in association with your breathing. So the next movement we're going to do is we're going to stay on your back. We're going to change things slightly. So instead of moving the leg out to the side, we're going to stretch one leg out and we're going to draw it back in again. Okay, so we're keeping the foot on the floor. You're sliding the leg away, we're sliding the leg back in. But as you slide out and in, I want you to think about keeping pelvis nice and level through the front. Keep the spine in neutral. Okay, so we're going to connect first. So coccyx to pubic bone again. Take a breath in. Breathe out, we're going to slide the leg out. Breath in, hold. Breathe out, draw it back up. Other side, breathe out. Breath in, hold. Breathe out. Keep going. Breath in. Breathe out. Breath in. Breathe out. Keep going. Breath in. Breath in. One more each leg. Breath in. Breathe out, move. Breath in at the end. Breathe out, move. So you can see that my back and pelvis are not changing position during this. So again, breath in. Breathe out. Breath in, breathe out. Now we're going to do one more similar exercise here. So this time we're going to take the foot away from the floor and we're going to come up to tabletop. So this is tabletop position. So knee over hip, foot level with knee. Okay, and then we're going to come back down. So obviously very, well, similar to the kind of walking action. So very functional, but a little bit harder because now we're taking the foot away from the floor. So a little bit more of a challenge for the core. So again, really important that we're keeping spine and pelvis neutral, nice and level through the front, arms down by your side. We're going to connect again, pubic bone, coccyx to pubic bone. So we're connecting, back passage to front, hold it, feel that tension, take a breath in. You can rest your hands on your lower tummy if you feel like you want to, just to feel what's going on and keep that connection there if you want to. So as you breathe out, we're going to take one leg up, hold it for a breath in at the top, and breathe out, bring it down. Other side. Breath in, breathe out. So again, as you breathe out, you should hopefully feel a little bit more of a almost deepening of that connection into your lower tummy and pelvic floor. Exhale, lift. Inhale, hold. Exhale, lower. We're going to do one more on each side. And then just have a little rest for a moment. So just hug your knees in towards you. So although they're really simple exercises, to do them properly is actually quite challenging because we want to try and keep things really controlled. We're not losing that position through the spine. We're keeping the pelvis level and we're thinking about really keeping that connection on with your exhale and with your breathing. So there's lots of different elements to consider and think about. So keep working on those. If you're not happy, if you feel like you can't control around the spine or your pelvis, perhaps just do the hip opening and the leg slides just for now until you feel like you've got a bit more control, and then you can lift the leg when you feel ready to. The next one we're going to move on to is we're going to do some pelvic tilts working into bridges. So if you've got back pain, sort of postnatal back pain, just do the pelvic tilts. You don't have to do the bridges, just work into those gradually. So we're going to start off just pelvic tilting. So again, we're going to just keep the ball in between your knees or the rolled up towel, whatever you've got. Little connection.
Take a breath in. This time as you breathe out, we're just going to flatten the small of the back down into the mat. Your tailbone is going to tilt ever so slightly, so you're just going to lift it away from the floor ever so slightly, and then we're going to come back off again. And again, so breath in, breathe out, gently flatten, tailbone tilts ever so slightly, and then we're going to come back off. Okay, keep going, breathe out. So again, as you exhale, you should feel a little bit more of a connection coming through into your lower tummy, and then come back off. Now, if you feel like you can, if it feels comfortable to do so, we can start taking it up into a bit more of a bridge. So we're going to breathe in to start, breathe out, we're going to flatten, but this time we're going to lift up just a little bit higher. So you're going to peel your spine away from the floor just a little bit more. Take a breath in at the top, and then we're going to roll back down through the spine. So try and replace one individual segment of the spine at a time back to tailbone. So breath in, exhale, coming up, hold it at the top. Now just lift up as far as you want to go, but mid-shoulder blade should be the highest point, so we don't want to go any higher than that, because then you start losing the neck at the front. So make sure you can feel those glutes activating. Squeeze your knees against the ball, hold it for a breath in, and then we're going to roll back down. So start from the top, and we're going to come all the way through and back down to the tailbone, and we're going to keep it going. So exhale, come up, inhale to hold, exhale to come down. Okay, we're going to do 2 more. And last one. Excellent. So come back down, hug your knees in. So again, simple exercise, but really useful exercise for the initial postnatal phase, because it not only helps to activate into your core, so thinking about all your core muscles and the big muscles around the pelvis, which also switch off during pregnancy, so thinking about your glutes mainly. It's also really good exercise for getting your spine moving. So again, just thinking about that posture that we were talking about at the beginning, where you tend to get thrown into a bit more anterior tilt. This exercise really helps to get you back into that nice posterior position, and just helps just to really mobilise into the spine. So when you first start doing this, you might find that the things judder or feel really stiff, and you can't get that nice segmental control. Don't worry too much. As long as it feels comfortable, keep practicing it, and as everything starts to come back together, it will get easier. So we're going to turn onto your side next. Just make sure that you've got support underneath your head, and we're going to bend the knees. We're going to do a little bit of work for your side glutes now. So we're going to keep the knees bent, keep the feet together. I want you to try and connect again. So thinking about your zip, coccyx to pubic bone is slightly different position. Well, it's a big difference in position, but it will feel slightly differently in terms of how you're connecting, and it might feel a little bit harder to connect here, but I want you to practice connecting in different positions. So coccyx to pubic bone, like we did before, just try and get that squeeze and that slight lift forward and up. We're going to hold it. You'll feel some tensioning hopefully in your tummy as well. Take a breath in. On the out breath, nice and easy, we're just going to open the top knee, and then we're going to bring it back down. So we're keeping the connection on. Breathe out and breathe in. Let's just keep it going. We're going to do another 2. So again, we're trying to deepen that connection into your core, pelvic floor to tummy, as you exhale and work with the effort. So when you're doing the hard bit of the exercise, so in this case, when you're lifting the leg, that's where we want to try and connect that bit deeper. So come back down. We're going to stretch the leg out. So nice straight leg. Connect again. Coccyx to pubic bone. And we're going to lift the leg this time, keeping it straight. And then we're going to come back down again. So we're exhaling to lift. Deepen into your core. And breathe in, come down. Connect, exhale. Inhale, get down. Keep going. Just make sure you're not holding your breath at any point, because that's really bad. It generates a lot of pressure. It's not an efficient way to be exercising. So keep going with that breathing. Last two. And come down. Now we're just going to bend the knee up and we're going to take your arms out in front. We're just going to do a little bit of mobility work for your rib cage and your upper back. Because again, during pregnancy, that area really does tend to stiffen up. So we're going to bring your arms in front, so your palms are together, draw your shoulders down, connect into your core, take a breath in. Make sure your head is nice and relaxed down on your pillow or your block. As you exhale, we're going to connect. So again, coccyx to pubic bone. And we're going to open the arm up. So you're going to separate your hand, and we're going to take the arm back as far as you can. Breath in at the end. So as you breathe in, you'll feel an increased stretch, hopefully through your ribs, and then exhale. And bring the hands back. So we're inhaling first. Connect, coccyx to pubic bone. Exhale. Open. Inhale, hold, and exhale, come back. So we're going to do two more. Now just make sure that you're not hunching that top shoulder, and your hips and pelvis are just staying stacked and nice and still. Make sure you're not rolling back through your hips. And return. We're going to do one more. Well done. So let's come up. We're going to turn over onto hands and knees just for a moment. So we're not going to do loads of hands and knees stuff at the moment. I just want you to, if you need to, just pop something underneath your knees just for a little bit of support. Excuse me, just doing my hair. So when we move on to session 2 of your postnatal recovery, we're going to do a little bit more work on hands and knees. Today, we're just going to practice engaging into your core on hands and knees. So your knees are underneath your hips. Hands can go where you like, so wherever it feels comfortable, really. You can take them a little bit further forwards or a little bit wider than your shoulders. Just make sure before you start that you're in neutral again. So if you tuck your tailbone underneath, come back down opposite direction. And then we're just going to rest in the middle. So you're just coming into that neutral, optimal pelvic position to recruit into your pelvic floor and your deep core, okay? So we're just going to hold this position, and I want you to think about that activation again. So we're going to breathe in first. As you exhale, imagine your zip again. So we're going from back passage or coccyx up towards your pubic bone. And we're going to engage into those pelvic floor muscles. You should hopefully feel some tensioning coming through into your lower tummy, and we're going to hold it. So just breathe. And then let it go. And again, when you let go, you should hopefully feel that that tension in your lower tummy is also letting go, okay? So we're going to do two more here. So again, just check you're in neutral. Breath in, shoulder blades down. Exhale, coccyx to pubic bone. Just gently drawing in through your back passage, drawing the muscles up towards the front. Feel that slight connection coming through into your tummy. Hold it and breathe. 3 breaths in and out. And let go. Now we're going to do one more. So again, have a quick reset. Breath in. And again, coccyx to pubic bone. Draw up through your imaginary zip. Exhale as you do so. Connect into your lower tummy. Hold it and breathe. And let it go, and we're going to have a stretch. So if you need to, just open your knees up slightly, stretch out your arms. Now when you're stretching, I want you to just think about letting everything go here. So we're relaxing the tummy, we're relaxing into your pelvic floor. So imagine you're just dropping down through that imaginary zip, you're letting it go all the way, and we're just going to focus on your breathing. So just think about taking nice big deep breaths in and out through the base of the rib cage. Okay. So as you breathe in, you should feel your rib cage lift up and out. As you breathe out, it's just a nice relaxed breath. So we're going to come back up onto hands and knees. We're just going to do some cat stretches here now, just to mobilise your spine again. So really lovely for the back. So we're going to take a breath in. As you breathe out, we're going to scoop the tailbone under. We're going to curl up through the spine, drop the chin onto the chest at the end. Hold for a breath in. And then we're going to come back down again, opposite direction. And again, so tailbone under, curling up. Hold it for a breath in, and then come back down. So we're starting from the tailbone, and we're trying to work all the way through the spine, one segment at a time, all the way up to the neck. We're just going to do one more. And then come back to neutral. Okay, well done. So we're going to turn over onto the other side, and we're going to do the other side, and then we're going to finish just with a few bits in standing as well. So come back down onto your side, knees are bent like they were before. Just check you've got enough space, because we'll stretch out the leg as well in a minute. Okay, so hips are forward. Connect first. So again, thinking about coccyx to pubic bone, feel the tension into the lower tummy. Take a breath in. As you breathe out, maintain that connection, and we're going to open up the knee, and then breathe in, come back down. So connect, breathe out, breathe in, come down. Keep going. We're going to do another 2. Exhale, lift. Inhale, lower, last one. And then we're going to stretch the leg out, nice and straight, connect again, breathe out, lift, and breathe in, down. And again, exhale, and inhale, down. So as you're moving the leg up and down, we want to try and keep that nice connection on. Again, feel that deepening through the core as you lift. But I don't want you to hunch your top shoulder. And I want you to try and make sure that you're not squashing your side down into the floor. So we just want to try and keep it just isolated to the hip. Obviously stop if you need to. If you had any pelvic pain during pregnancy, it could well be linked with the fact that your muscles have weakened, or, you know, again, due to changes in posture. But if you get any pain around the pelvis during these exercises, obviously stop. So last two. And then we're just going to bend the knee up, and we're going to go back to your arm openings that we were doing before. So we're going to take your arms in front, palms together. Make sure your head is down on your block. Take a breath in. As you breathe out, we're going to open. Hold for a breath in at the end. And keep the connection on. Exhale and return. Breath in. Think about that coccyx to pubic bone. Breathe out, open. Draw the shoulder blade down. Make sure you're keeping pelvis stacked. Breath in, hold, and return. We're going to do two more. Excellent. So, carefully come up into sitting. Just make sure your head feels okay before you come up into standing. So during session 2, we're going to be doing a lot more standing work. We're going to start bringing in some resistance as well. But like I mentioned before, I just want you to start here and just get that deep core switching on, get you used to switching it on with simple movements. Just have a little check to see if you've got any diastasis. Don't worry if you're not sure. Like I say, I'm here to help if you need any questions answered with regards to that. But the aim of this session is just to start getting some activation and just getting brain to muscle and just firing off those deep core muscles, because we need to get those strong and healthy before you start to load, and particularly in relation to going back to any impact exercise. So now we're in standing, it's nice just to finish just with a couple of functional movements, because obviously you've got a newborn, you are having to bend, you are having to squat, you are having to lunge. So these are things that we need to start thinking about in terms of bringing them into your exercise routine as well. So just make sure that your feet are under your hips. So like we did at the beginning, we're just going to do a quick postural scan through. So just make sure that your weight is even through the feet, so big toe, little toe, heel. Knees are very slightly bent, and then just check that your spine and pelvis are in a neutral position. So like we did at the beginning, imagine your bucket of water. We're just going to make sure the water is level in your bucket, so the pelvis is neutral, the ribs are stacked over your pelvis. Okay, shoulders are drawing down. We're going to start with some really simple arm movements. So I just want you to tuck your elbows into your side. We're going to connect again, so you're going to think about coccyx to pubic bone, okay? But when you do it, make sure that your pelvis stays in neutral, so we're not trying to really tuck the tailbone under. It's just a lift, so thinking about that squeeze, and then that gentle lift forward and up to the front, okay? Now we're going to try and maintain that. Remember, it's not as hard as you possibly can, okay? So just a gentle connection. Elbows are tucked in, take a breath in. Breathe out, we're going to open the arms out to the side, and then breathe in, return. So we're just trying to maintain that connection, coccyx to pubic bone. Breathe out, open, and breathe in, close. Breathe out, breathe in, breathe out, breathe in. Let's just do one more. So really, really simple, but again, it's just getting you used to activating your core with really simple movements in standing. Standing is harder for you to recruit into your pelvic floor and tummy. So again, it's just to challenge you in a different way. So this time we're going to come forward with the arms. We're going to open them out to the side, making sure you're not losing that neutral position. Come back to the centre, and then fold back down. So we're going to connect first, same as before.
Breathe out, push forward. Breathe in, we're going to open. Breathe out. And breathe in. Let's keep going for 2 more. So breathe out. Breathe in. Breathe out. And in, last time. Shoulders stay drawing down, just make sure that rib cage stays stacked over the pelvis. And then just drop your arms down, we're just going to roll the shoulders. A couple of times each way. Now we're going to do some squats, okay? Now with this session, we're not going to come down too low, we're just going to take the feet slightly wider than your hips. Any problems whatsoever, stop, leaks, dragging, pressure, aching, any symptoms whatsoever that are unwanted, then please stop, okay? Now with these exercises, again, we want to try and bring in a bit of core functioning with it, so pelvic floor to tummy, okay? Now it's important to remember that normally when we're sort of trying to teach these exercises, when you're exhaling is when you're doing the hard bit of the exercise, because that's when we want to get a little bit of a deeper core connection. So when we do a squat, the easy bit is actually coming down into the squat. So that's the easy bit, okay? Pick up your baby, whatever it is that you're going to be doing here, okay? As you're exhaling, so as you're lifting up, because this is the hard bit, you're working against gravity, your muscles are having to work harder as you come up. That's when we want to exhale, and that's when we want to try and connect into your core, pelvic floor to tummy, okay? So what we're going to do is we're going to come down into your squat, we're going to breathe in as you come down. Now when you come down into your squat, we're going to reach the arms forward. Make sure that your knees are bending over second and third toe. So we don't want any of this inward sweeping action with the legs, okay? We're going to exhale, and I want you to think about coccyx to pubic bone as you come up, okay? So we're going to come down into your squat, nice and controlled. Breathe in, exhale, coccyx to pubic bone, and we're going to come back up. Okay, so inhale down, reach the arms up, keep the shoulders down. Exhale, coccyx to pubic bone. Just try and get that little connection. Even if you feel like it's not a lot happening, you might feel that connection coming through into your lower tummy as well, hopefully as you lift as well. So we're going to come down, breathe in, breathe out, come up. Breathe in down. Coccyx to pubic bone. Imagine that zip, just gently drawing up as you lift. We're going to do 2 more. The last one. And come up. So really useful to practice, but also every time you go to pick up your baby during the day, get them out of your cot, whatever it may be, bending down to pick stuff up, which we do all the time, I want you to try and bring this in with your day-to-day functioning. So for example, if you're going to pick your baby up out of the cot, you're going to breathe in, try and bend from the knees. We're going to come down, pick your baby up, bring them to you. So make sure you're bringing them in close to you. Try and keep them central if you can. Exhale, connect pelvic floor to tummy as you're coming back up. Okay, so we're breathing in to come down, pick it up, whatever it is that you're picking up. Exhale, think about your imaginary zip, and exhaling as you lift. So we're trying to bring that in with everyday function that you're doing. The other good exercise to practice is a lunge. So big step in between your feet. This is the last one we're going to do. Just make sure both feet are pointing forwards. Now when we're lunging, try and think about back leg doing the work. Okay, so the front knee will bend, but it's the back leg that we're really focusing on. So the back knee is going to come straight down towards the floor, and then we're going to lift back up again. Okay, now again, angling of the knee is important with this. So particularly with that front knee, I don't want you to sweep the knee across your body. Okay, so we're just keeping it really controlled. Think about that second, third toe as you come down and then as you come back up. Okay, so we're keeping up nice and tall. Again, same with the squat. So we're going to breathe in to come down, breathe out, exhale, and connect as you come back up. Okay, so we're going to breathe in and then think about your zip, exhale and lift. Again, it is harder in this sort of split stance position to try and feel that connection, but even thinking about it is still doing something. Okay, so even if you're just trying to really focus on that engagement, that is still going to be activating those nerve pathways. Okay, so we're going to breathe in, breathe out, lift. Let's just do 2 more. So breathe in, breathe out, lift. Last one. So we're trying to keep pelvis nice and level. Well done. Bring your feet together. We'll do a few on the other side as well. So again, this is a functional movement. This is stuff that you're doing throughout the day without even realising it. Every time you go to pick something up off the floor, you come down into a lunge. So again, it's just trying to bring these functional movements in a very controlled way, if possible, throughout the day as well. The more you do it, the more you're going to be activating those nerve pathways, and it's going to become more automatic. So again, just check your alignment first. Nice level pelvis. We're going to breathe in to come down. Breathe out, think about your zip. Exhale as you come up. Breathe in. Coccyx to pubic bone. Exhale and lift. Let's keep going. We're going to do 2 more. Well done. And then just bring your feet back together. Have a little shake off of your legs. And then we'll just roll your shoulders a few times each way. So I hope you enjoyed this session. There's been quite a lot of education, a lot of talking going on as well, but I think it's really important to get that information to you. I would suggest, if needs be, once you've sort of gone through this session a couple of times, just fast forward the first bit where I'm talking and just get to the exercises. But the more you practice these, the more you're going to start connecting with your core. You're going to start bringing it in with everyday functioning as well, just thinking about your posture, how you're holding yourself, and just connecting with those deep muscles, which is really what we're trying to focus on in these early stages. Once you've got a bit more connection and you feel happy and ready to move on, then you can try and move on to the level 2 class, which I'm going to be posting up over the next few days. But I would say start here and carry on with this session for as long as you feel you need to. If you've got any problems, any symptoms, then drop me a message, and if you've got any concerns, then feel free. I'm always here, and I'll reply by email, so that's the best way of contacting me at the moment. So do get in touch if you're not happy, and if you've got any questions, just ask or pop some comments in